trach care and suction are done together for your sign-off. They're not always done together in real life. Okay, they can be done independently of one another. What you need to bring with you have 30 minutes for the sign-off. What you need to bring with you is your isolation gown and your mask. That's got the eye protectant. This is your PPE to protect you from flying, and I do mean flying, sputum. Okay? In your bag, you have a Ziploc bag that's got a lot of dressings and non-sterile drapes and some other things. The non-sterile drapes are not in a package. They're loose and they're white. And they've got little checkerboard pattern, like little pattern on it, imprinted. So you need your non-sterile drape. You need your suction catheter kit. You have 2, leave 1 unopened. Your trach care kit. You have 2, leave 1 unopened for sign off. And then you have normal saline. Bring that. And we'll provide the hydrogen peroxide for the care part for practicing. Because not all, well, we'll get to it when we get there. Okay. All right, then you'll need clean gloves that are in the lab. Don't use your sterile gloves yet.
And your stethoscope.
You need your stethoscope, yep. Okay. When you come to practice and when you come to sign off, always have your PPE with you, personal protective equipment. So it's always in your mind, I need to protect myself from flying sputum. Are you going to see a lot of people in the hospital setting not wearing this? When they do trach care and suction, you might. Because if a patient's not on isolation, technically you don't have to wear this. But if I'm going to have sputum shooting at me, this protects you. Sputum will spew into your mouth, your nose, your eyes, and on your clothing. Probably Mrs. Bodner has seen it. I know I've seen it. She's seen it. It's disgusting. Not to mention, if there was blood in that and now it's in the mucous membranes of your mouth or your eye, danger, Will Robinson, danger. Bring your PPE. You don't have to put it on when you're practicing. You don't have to put it on in sign-off because you're nervous and you sweat a lot when you have that on. But you always need to bring it with you to have it on the bed so you're constantly thinking about the fact that you're protecting yourself. Good? Okay, now let's go back and review a little bit of A&P with your mannequins here. We have little Timmy, and he's got his, you want to do the demonstration of his snuffication?
Oh, just have to.
Yeah. All right, so there's Timmy. Okay. We could do this to Timmy and he's okay. Why is that?
He's breathing.
He's breathing through his trach. That's his airway. All right? So don't think putting a nasal cannula on Timmy will do him much good. He's breathing through this artificial airway. So likewise, we have to give this really healthy respect. This is his airway. We must protect it at all times. Okay? So when we're working with this, we want to make sure that it doesn't pop out. When we get to trach care, we're going to talk about some methods to make sure that doesn't pop out when he coughs really hard, thereby losing his airway. And let's talk a little bit about the anatomy. You've got your trachea. Okay, you guys remember that. And then it bifurcates, or branches, right, into the bronchial trees. If you go straight down, like let's say I had a poker and I went straight down that trachea, the tissue I would land on right before that bifurcation is called the carina. When we're getting our suction catheter to go down, the first pass we go down, we go far enough to actually feel that resistance. We're at the carina. Then we're going to pull back about 1 inch and note the marking, because the rest of the passes I don't want to go bang, 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 bang on the carina. I only want to go to that stopping point of 1 inch above it. Does that make sense? Because otherwise I'm going to really cause tissue damage, right? That's not used to being touched, that area of the trachea. Okay. The other bookkeeping things that we did later. Anytime that you're going to do trach care or trach suction, you must do a full respiratory assessment. We'll talk about what that includes, before and after. The before tells you their baseline, where they are. The after tells you whether what you did was effective or made a change, positively or negatively. Okay? So you always have to do that full respiratory assessment before and after trach suctioning, before and after trach care. Is there anything else that was just orders of business? Okay, we got it. Okey-doke. So we're going to kick off with trach suctioning first.
my show now?
Let's do that.
Okay, good.
We were experimenting earlier.
Yeah, we were. And we found our happy niche, so we're gonna continue with this. Remember, practice makes perfect. What you see today might confuse you. Yeah, it should. Once you practice, you'll be golden. This is when the sterile, I'm gonna put sterile gloves on. This is where everybody gets a little anxious because they're not quite sure. But we're there to help you, okay? Any questions, stop us. And I do talk fast, okay?
The video, there is like 1 or 2 points that are slightly, and I do mean slightly, different from how we do it today. If you're one of those people that if one thing is a little bit off, you're gonna come screaming into the lab. But on the video, don't watch the video.
The checklist
Don't
is
watch that.
great. So
The video is great, but if you're one of those people that gets your knickers in a stitch, because when we made that, it was one number for this wall section. Now, the recommendations are a different range of numbers for wall section. And then we take the catheter out at a different point than she did. That's it. But if you're one of those people where your heads pop off, just don't watch it, because as you guys have learned, it's coming in and practicing that gets you to learn the skill, right? So come in and practice a ton. You guys have done really well with that. Come in a lot and practice, and you'll have this without a problem.
Okay,
The videos are just icing on a cupcake, and it's too many calories anyway, so.
Okay, so for trach suctioning, I need a doctor's order. Is usually written Q, 2 hours, and PRN. PRN means as needed. So if you need it before the 2 hours, you've got the liberty to do that. Remember, my patient probably cannot talk. I'm going to bring in a part of the chart with the medical record number, and I'm going to compare it with his name, date of birth, allergies. He might have an allergy, but he should have an allergy bracelet on, okay? And if it's a fresh trach, I will ask him about his pain. Now, a lot of times they might have a little chalkboard, and a pain scale is still 0 to 10. They can raise their hand. I will medicate them, not really high potent stuff that would compress his or compromise his respiration, but just enough so it cools and calms him down a little bit.
Well, so it takes away the pain.
Right, okay?
So she checked the order,
I got my chart, I checked.
and it made sense for her patient. So you check the order, you make sure it makes sense, you come in, you introduce yourself. Hi, my name is so-and-so, I'm gonna be your nurse today, may I see your armband? And then instead of asking, if he has a speaking valve, he can reply. If he does not have a speaking valve, he cannot, he'll just be mouthing. So that's when we were gonna, if he can't speak, it is 3 unique identifiers: name, date of birth, and medical record number.
So the next thing I'm gonna do
And
is
she explained the procedure.
explain the procedure, because a lot of times they're awake. They might not be able to talk, but they can hear. I'm going to do a full respiratory assessment, including vital signs, 6 to 8 places, anterior and posterior, and not over bone, not over clothes, and not past the bra line.
And we raise the bed to a position of comfort for her. And we make sure the head of the bed is about 45 degrees.
So under clothes, I go boom, boom.
We'll teach you more thoroughly about the method of auscultating lung sounds when you get physical assessment. You just need to know that it's 6 to 8 places anteriorly and posteriorly, not over clothing or bone, and never past the bra line, because then you're not listening to lungs anyway.
This is not a sterile drape. It's just a drape that I'm going to use so I don't get any mucus or any kind of secretions or any saline all over his pretty gown that I just made. Okay? And I'm not wearing this. I'm just leaving it there.
And then there's something special about her table.
Clean, dry, waist high.
I know.
What?
Earlier.
Oh, that's okay.
We'll get it.
We'll get it. Life is good.
That's her new mantra, I think, for 2015.
Yeah. I'm going to put just one pair of just regular gloves. I'm going to check my suction. And now, back in this simulation, the nursing lab, we have it on the table, but here it's on the floor because we don't have a table. Huh?
Did you change the plug?
What plug?
I think we unplugged it.
We did?
No?
No, we unplugged this sucker. It has 2 things on it. I don't know what the other thing means. I don't want to know. Okay.
That's the head of the bed.
Okay. I'm gonna turn it on. It doesn't make as much noise as I want.
We have portable suction, but for wall suction, the settings that you want in the hospital, because you'll have wall suction, is going to be between 100 and 120. On the video, I think she says 100 and 150. It's 100 to 120. It's strong enough to suck up the secretions, but not so strong that it can cause damage.
So with my one gloved hand, the suction tubing is attached to the suction machine. I'm just putting my thumb over it.
While she looks at the meter,
And I'm checking it. You guys can't see it, it's down on the floor. Just to make sure
the
it's,
suction was right.
okay? That's why I have the glove, because I'm not sure if there's any mucus or any debris on here. I just don't want to make it worse than I am. Take it off the correct way.
Students often, because there's only one glove, want to go and pinch that first one.
Yeah.
Don't pinch it, go under it.
Oh, I gotta take a new one.
Yeah, it is right now.
Wow. No, it isn't.
Oh. Yeah, so her table must be clean, dry, and waist high for anything sterile.
I'm just taking this right out of the package. This is touching my clean, dry, waist high table. Any packaging that you have, if there's an out date on it,
An expiration date.
yeah, I would say out date. I meant expiration date. Abide by that. If there's no expiration date on any kind of medical supply, it's sterile unless it's been tampered with. Okay?
Good luck with this one.
The box is inside. Yeah, I can fix it.
Now, as she's opening that, she's only holding that outer lapel. She's not putting her hand inside the glove package, so she's holding it here and opening it. If she were to put her hand under here to open it and then it falls back on the item's no longer sterile. Make sense?
Mm-hmm.
So you only grab the outer portion.
And you can sort of like pinch it and it should stay. This usually was on the outside,
Well, it hasn't been for them.
but the new ones didn't come in.
So the box she's going to take off, but she's not going to touch the gloves. So she just grabbed the outer part of that box and she's not going to touch the inside at all.
Just on the side. I don't want to touch here because that's where I'm going to be putting my fluid. Oh, these boxes.
Do you want me to help? Shut your eyes. Shut your eyes, don't watch.
Don't watch. Don't watch. Oh my Lord. I got it. Now don't watch.
Yeah, don't watch. This is a terrible one. I've never had that problem.
Where's the other box? At least I work better with that. It will not be like that for you guys, trust me.
No, I've never had that problem. This must be one that we need to just get rid of, I think, Mrs. Howell.
I think you are absolutely correct, and I am getting rid of it after
I think only attached like the plastic to the
It just
sits
sits right on
there. This is a test of. I should just left it alone and just poured the saline in, it would have stuck. Oh Lord.
Anybody good with origami?
Oh,
I can help.
I can help. Here, I'll hold the box. You did not see this.
You would never ever dream of
I'm doing
contaminating
this.
this.
But we are definitely, I should have known that wasn't a new one.
Yeah, but I've never had this problem. And I've used them for over and over and over and over and over and
You see,
over.
remember these were the ones that were real crappy.
You're good.
Leave it like that.
Okay, it's sterile inside.
Okay. You did not see that, and don't record this.
We did. We're gonna put it on Facebook too.
You gotta
so
put
we
on the
can go over it.
bloopers.
Yes.
Yeah, do that. My saline, it has not been opened.
What are you checking?
I'm checking the manufacturer's date. Once I open it, I will make sure that my initials, my initials, date, and time. It's good for 24 hours. If somebody came before me and opened it, I would make sure that it was within the 24 hours. I would take off the cap. I'm not putting the cap down here. I'm keeping it,
So contaminated if she sets it upside
and
down.
I'm going to do something called lip it. I'm not doing it because we're on the trash can. Remind me to bring the trash can.
Yeah, it's lipping, and as you pour, a little bit comes out and kind of rinses off that edge. It doesn't really do anything, but it's what we do in nursing. But for a brand new bottle, you don't have to do that. So she checked the expiration date, she checked the fluid to make sure that it was clear, that it wasn't an off color and there was nothing floating in it. Because you never know, you might get something that was manufactured in a plant that had something go wrong. So,
Right?
yeah.
Okay, now I'm putting the sterile gloves on.
Okay, so let me tell you how the sterile gloves are put in there. The
I'm-
sterile gloves, you can see how the glove is cuffed backwards? The part she's touching is the part that's actually going to touch her hand when it's on. So that's the only part that she can touch so far.
The moment I put my hand in here, I'm gonna stretch it out and I can see where my thumb is. I still am touching the cuff.
Just the part that's going to be
That's
inside.
touching my, okay?
Done.
This is sterile. Now, I can touch any part of this glove because this hand is sterile. I'm gonna go under the cuff on this one.
So she's putting all 4 sterile fingers underneath in that sterile area
And
to
I'm
protect from hitting her hand on the way in. And then her thumb goes away because it's too easy for that thumb to hit your wrist, the gloved thumb. Now that she's sterile, her hands can't go below her waist and they have to stay in front of her at all times.
I'm pulling out, this is called a suction catheter. This is your suction tubing, this is a suction catheter. When I'm doing this hand will remain sterile. This hand will have, I'm right-handed, so I'm speaking right-handed people, will have 3 jobs.
If you're left-handed, flip it.
Yeah, just flip it. We'll help you with the flipping. Okay, this hand will deal with the suction, the ambu bag, and the tray collar. This hand stays sterile. Okay, I'm going to get my suction tubing connected to my suction catheter, but I'm going to make sure I do not touch my right hand. And I want to make sure it's a firm. If it's not, it's going to come apart. I'm going to pull it out. This hand is not sterile, but this hand is. This, once I put my finger or thumb over it, it's going to occlude it.
So that's occluding. In order to have suction work, you have to occlude the hole.
See?
Okay, you have to occlude
Now
it.
it won't suck because I'm not occluding.
Make sense?
Got it?
And while she's there, I just want to point out this. This is the Trach collar, and it's providing humidified oxygen. So make sure that the humidification bottle always has something in it, that it doesn't run dry. You and I, we humidify our oxygen because it goes through our mucous membranes of our nose and our mouth. His does not. So in order to keep his secretions moist, that's the only way they can move up and out, is if they're moist. If they start to get dry and tenacious, they could stay down there and form a mucus plug that could actually block one of the branches in the lungs. So it has to stay moist. So anytime that you can, put this Trach collar back in place so that he's getting humidified oxygen. There's oxygen in our atmosphere, okay? So students are like, he's not getting any oxygen. Yeah, he is, but it's not humidified oxygen, okay? And it may not be as much. This will get condensation building up, and if this tubing is sitting here, you can see this area here might puddle and get condensation built up. Don't do this. It'll pour all over him. So make sure you get the puddle to go back down into the bag. If there's a collection bag that sits on the floor. I don't have one attached to this, but there's a collection bag that sits on the floor at the end of this tubing, and then it goes up to the oxygen that's humidified. So just make sure that you're getting any puddles to go back down into there. Don't tip it the other way, or he'll get soaked.
Okay, so my non-sterile hand will move away with the Trach collar, and I'm keeping an eye if he's on the monitor. I'm gonna keep up.
So before she started, this is on, oh. When she came, she auscultated lung sounds. We talked about that. We're also gonna look at his work of breathing. So does he have retractions? Does it look like he's struggling to breathe? We're going to look at his skin color, because a late stage of respiratory stress would be cyanotic lips, so starting to turn blue. We don't want that. That's a very late sign. And we're also going to do a full set of vital signs, because what happens to our blood pressure, heart rate, when we are feeling very, very anxious because we can't breathe? Those will go up, right? The blood pressure, the heart rate will go up. What about the respiratory rate? It will go up. And then what will the pulse ox do?
go down.
Right. So that's part of our full respiratory assessment, was the auscultating, looking at his work of breathing, his skin color, and a full set of vital signs. And then we'll compare all of that at the end to see if what we did made a difference.
Okay, my sterile hand will not touch anything here because it's not sterile.
And
So,
she keeps these two hands apart from each other to keep the line nice and straight and taut. The reason for that is because if it coils, if there's slack, it's easy to hit and contaminate. So if you keep your two hands apart, going down and coming back, you're minimizing the risk of a curled up piece hitting something and you don't even realize it and then contaminating it.
so I've gone down as far as I can. I've
Can you
hit.
get number one?
Well, I was gonna do it in between. So I've gone down to have hit the carina. I've come back. Some of the catheters, suction catheters, might or might not have numbers on them. If they don't have a number on it, you pull back about an inch. Remember how far away you are, estimate. If it has a number, remember the number that you came back an inch on. When I come back, when I went down, I did not put my thumb on the suction.
Because that creates suction and we can cause injury. We
Wow.
only suction on the way out and it's intermittent. So we don't grab hold of that tissue and yank. It's suction, pause, suction, pause, suction, pause. By her thumb going on and off, on and off, on
Can
and
we do it
off,
now?
on and off. And then this hand is going to twist on the way out. So it's like roto-rooter going. Right? That's how we're going to suction the whole way out.
So I'm gonna do it.
And hers
And
didn't
I'm
go down
not
very
going
far.
like this real fast because I'm not gonna accomplish anything. I want a nice suction. My right hand is going down the suction catheter, comes out. The moment it comes out, my hand that's not sterile puts back the trach collar.
And see how she wrapped that? That minimizes the risk of that getting contaminated.
I'm gonna notate the color, the amount, the odor, and consistency. Okay? And then put my thumb or finger on the thing that,
The valve. Suction valve.
yeah, control valve.
Mm-hmm.
And I've cleaned it out. Now I notice his oxygen saturation going down, down, down. My hand takes away the trach collar. With the ambu bag, I'm going to do 3 to 6 breaths at his normal rate of breathing.
And this is to either they used to call it hyperoxygenate, now we call it pre-oxygenating. And you can do it before you get started too, if his oxygen saturation is fairly low, or even 90, 92, 90, because we're going to be sucking all the air out. So you can pre-oxygenate him before you begin, and in between every single pass if you feel like he needs it. It's a nursing judgment. Okay?
So I'm going to go down again. Wrap this up, this hand.
She went down for no more than 10 to 15 seconds, and she has to wait at least 30 seconds between passes, because the minute that goes down, guess what he's doing?
Okay.
Oh, he's coughing all right. You want to know what kind of coughing? Tears are streaming. He looks like he's choking to death. You feel like you're killing him. How does it feel when you guys breathe in a piece of really toasted, crunchy English muffin?
Oh,
You feel like you're gonna choke to death.
yeah.
That's what it feels like.
Oh,
That's why we can only sit down for 10 to 15 seconds. It's a necessary thing though.
right.
But
like,
they cough, they come off that bed, they cough so hard.
It's like holding your breath. You hold your breath.
Only
So,
10 to 15 seconds, yeah.
so I'm going to go back again. Notice I have not touched the trach. I've just gone in with the catheter. Now little Timmy doesn't go down too far. The mannequins will. So I remembered the number. I didn't hit that carina because I don't want to upset your carina and make it bleed. Upset, I shouldn't say.
I'm
So
sure they have emotions too.
the moment I come out, with that hand, the trach collar comes back on. Color, amount, odor, and consistency. Suck it out. I can do that up to 3 times. After that, there might be a mucus plug down there and I'm not accomplishing anything. I would call the respiratory technician, stat, have them come right away. They have medicines and they do certain treatments that can really pull up the mucus plug.
How would you know that there was a mucus?
Because he's not breathing right.
Okay,
I
well,
haven't accomplished anything.
Here's how she'll know. So, if you were stopping here, you would remove that drape because it's mucusy, and then you would take off your gloves with the way she's going to show you. But we're going to move straight into the next one, so we're not going to take it off. And if she needed to go down 3 times, she would have. And sometimes on that second pass, you might only get a scant amount. And you can look to that person and say, does it feel like I got everything? You know, do you think I need to go for another pass? And he might say, no, that was good. So you can go up to 3 times, but you may not need all 3, okay?
And if he was unconscious, he would be on his side. I'd be suction on this side. Okay, I'm going to take this off.
You do the same thing. You grab it there, wrap it up, ball it up, and then underneath, so that it's all going together. So,
Throw that off.
what does she do afterwards?
Wash your hands.
No, after you finish the suctioning, remember we talked about
Oh, probably listen to him to make sure how he sounds.
a full respiratory assessment.
Okay.
So she'll auscultate 6 to 8 places anteriorly, posteriorly. What else is she checking?
Vital signs,
A full set of vital signs, see if they've improved. What else?
skin color,
His skin color should be nice and pink.
Last one.
all socks.
That's part of your vital signs.
Uh,
What's the other thing? That shows that somebody's having a difficult time breathing.
Oh, respiration.
No, that's part of your vital signs.
Is
Oh,
labor breathing?
Work of breathing,
okay.
right? Is he still struggling to get air?
Okay.
Is his chest heaving?
If he's still heaving, then you would know that there was a blockage. Then you would.
Or
fix it,
if,
right?
well, you won't necessarily know there's a blockage.
Okay.
Okay, but you'll know that there's something that you weren't able to fix.
Okay.
That's all you need to know. You don't need to know if there's a blockage, but if his stats aren't coming up, if he's still in respiratory distress, his lung sounds don't sound like they've gotten any clearer, if he still looks like he's got retractions and it's hard work, labored breathing, you need to call respiratory stat. As in like immediately stat. Because like she said, they can give him a bronchodilator to open up the airway. Maybe it's constricted. They can also shoot a little saline bullet and suck things out. And they can also suction beyond the bifurcation, which we cannot do. Okay? All they do is live and breathe lungs all day, all night, 24/7 at the hospital. Okay? So you'd call respiratory stat if you were not able to get him stable. Questions about trach suctioning? The reason we're doing it every 2 hours and as needed is to keep it patent, keep it clear. I don't want it to occlude. If I lose the airway, then the heart stops.
How do you spell Carina?
Carina.
Sorry.
CA.
A lot of students come back, oh, okay, I hit the corona. No,
Yeah.
it's the carina. Any other questions about trach suctioning? Staying sterile is key. It's really awkward feeling, and the only way you're going to get comfortable is coming in and practicing. It feels extremely awkward. Mrs. Bogner, you're such a good student. Look at all your questions.
Sorry.
That's okay.
Do you think it's more advantageous if they come in groups to practice?
They can.
Well, it's always, like you guys have been doing kind of, but it's always nice. Because remember we said grab the skills sheets, the skills checklists, and then you come in and you say, hey, let's all meet in the lab this day, this time, whatever. And maybe there's 4 or 5 of you around this mannequin, and one of you has the checklist, and you're watching one of the students do it, and everybody's helping. Then you just go like round robin style, so everybody has a turn. You're teaching while you're learning. It really is very helpful in helping you understand the whole thing. And then the instructors flit around between groups. Because, this is the teaching session. We don't sit and reteach you. Like, if you come in, I can't say, okay, let me just reteach you everything completely. This is your teaching session. So come in and practice, and then the instructors bounce from group to group to group to group to group. You guys doing okay? You guys need any help? What was your question about that? Yep. All right, you guys are doing great. Keep going. Okay. You have good questions.
Yeah. And for anything that I do, I've always washed my hands and I've provided privacy. But here we don't have any curtains, so it's really hard to do privacy.
Yeah, you're always going to provide privacy because nobody needs to see him struggling. So if he's got a door, shut the door or pull the curtain.
And if I was just finishing and just doing suction, I would do the whole respiratory assessment, including vital signs and skin color, all that stuff. But I'm going right into the care.
So she just did all of that. Now with care, it's routine. So the only way that you can know if he's in respiratory distress, we would never do something routine if he's in respiratory distress, correct? we would solve the problem with the respiratory distress first. So the only way that you can know if it's okay to do trach care and to establish that he is respiratorily fine is to do that full assessment. That's why you have to do the pre and the post for that. We need to establish he's okay. Yes.
First off, are we gonna have to actually do like all the vital signs, or we just have to mention that we're doing it?
You have to mention it
Just
all.
mention it.
Yeah.
You're the cute kid.
Oh, yes. And like she talked about, you know, especially with the care, we're going to be putting a Q-tip and drying and cleaning underneath this.
Thank you.
And if it's a new incision, just be very mindful that it could be very painful.
Watch your back.
Yes. And then she's got a trach care kit that's got some ties, and I also am going to show you another type of tie for securing it. This is done every shift, okay, or every 8 hours, depending on the institution. You don't need an order for this. The other one you do, the suction, you need an order for suction. You make sure it makes sense for your patient before you move on. This one you don't need an order, it's just routine cleaning, again, to make sure it's not getting a lot of mucus building up. We take it out every 8 hours or Q shift to clean it so that it stays clean. A lot of institutions will have disposable inner cannulas, and those are the bomb. You come in, put on a pair of regular gloves, take that off, you throw it away, open up the sterile package, touch just the outside of that inner cannula, put it back in, change the gauze, done. Those are nice, but we're going to teach you how to clean it.
But not every institution has that. That's why you need to know the Bayer.
And not every patient has a disposable one because they're expensive.
Same thing with the product. If it is expiration date, check it and make sure it hasn't been tampered with. You have you have two of these. One is for your practice. Try to fold it up and put it nice every time you practice. It won't be so hard.
Yeah, don't throw anything away.
No. So this has been open, so bear with me.
Everything we use pretty much has already been opened.
Yeah. I will not touch anything in here. That's a sterile. I will mainly just have my hands here and just right here where I've opened up the flap. Okay. First thing I'm going to do is I'm going to take out the sterile drape. And as you notice,
She's just touching the outer 1-inch border.
and you're going to see a shiny side and you're going to see a not so shiny side. The shiny side I want to put down. My 1-inch borders are allowed to touch.
And the shiny side has to face her because watch how she puts it down. See how she's not leaning over?
I'm not doing any of this because I'm
If the shiny side was the other way, she'd have to lean over as she set it down. So the side that goes on the table must be facing you. So you can step forward and set it down and step back. Now that's sterile. I want you to picture that it's the gold at the end of the rainbow. And you know, if you look down into the hole, it glows, right? Ah, sterile. So picture that. Oh, sterile.
Okay,
How far down?
we're pretty far.
Really? Well, here, let me fix it because theirs won't be. Don't look.
Don't look. Okay, don't look. These are your gloves. I can touch the outside of the package because I'm just going to put it down on my clean, dry, waist-high table. With all the contents in here, without leaning right on my sterile drape, I'm going to go above it, just drop it. If this stays in, that's the brush, leave it because that's what I'm going to be using. A lot of times it will stay in there. So what I'm going to do, my saline, remember, 24 hours, make sure there's no sediment, not any sediment, no
Just
sediment.
anything floating.
Yeah, anything.
The right color,
Right.
expiration
I have to use
date.
the right English for you, because you're always on my English. Okay. All 3 containers will get the saline, and as you notice, I'm not going over the sterile container. I'm going back, and my bottle's not touching the tray. It's above.
Don't ever lean over it. She's going around it. Just
And
like
I
she's not
didn't put
leaning
my
over that.
cap down like that. I held my cap. Put that back. Peroxide, some institutions are still using peroxide. know your institution's policy.
Peroxide is very, very caustic to skin. So if you're one of those people, it's a half and half solution. If you're one of those people who likes to put hydrogen peroxide on cuts, don't. You're actually oxidizing your white and red blood cells. They can't really heal very well. So in that long chamber, she put the half and half solution. Then there's another chamber for rinsing all that solution off. And then there's a third chamber for the Q-tips that will have no hydrogen peroxide on it for cleaning. But you may only get like two little, it looks like 2 orange juice containers full of saline. So one would be for washing and one would be for rinsing. But many institutions just use normal saline completely for cleaning. They let the friction of the action clean and don't use hydrogen peroxide. So know the agency's policy. My Velcro is sticking to it.
So, for sign off, I've noticed this has happened a lot. People are so eager to put your gloves on that they forget to take out the inner cannula and put it in here.
Because it's not sterile,
right.
outside.
So, just stop and think and make sure that it's not there before you put your gloves on, okay? Because you do not want to put your sterile gloves on to take out the inner cannula.
Because then you're contaminating your hands.
So these are just the regular gloves, not sterile. Now what I'm going to do is take off the trach sponge first, and especially designed for trachs. In the manufacturing world, they have a special machine that cuts it so that there's no fibers coming out. You don't want any fibers down the trach. That's a foreign body. That's a no-no.
Yeah, it's pre-made with that split. It's not ever cut.
So you don't want to cut it. We're going to reuse this, so just bear with me. But before I do that, I'm going to notate to myself so I can document what the drainage was, the amount, anything special on this trach dressing.
Same thing as we did with the trach, right? The odor, the color. If there's a lot.
Now,
if it smells awful.
Different trachs will have different things. This is a turn and a straight out. Some will be a squeeze and straight out. So I'm holding my one finger on the faceplate, pulling it straight out.
Because otherwise you make the whole faceplate and everything move, and you can initiate a lot of coughing.
Right. And I put my trach collar back on. I'm going to very carefully drop in the inner cannula.
Into what form?
Into
The
the
big one that had the hydrogen peroxide and saline.
And I'm taking it off the correct way.
And see how far away she is from her sterile field? Students in the beginning hover way too close. Take a few steps back, Jack.
Now I don't have a lot of room, so I'm just going to make do with what I have.
Again, she's just going to grab the outer portion of the package and open.
Here's my cuffs again. Oh, we got new gloves this time.
Ooh, those are the yucky kind.
Oh.
Only holding the part that will touch her hand. They just aren't very giving at the wrist.
God bless you. So the moment I put my hand in, I can move it around and I can find it in my.
Wait, did you wash your hands before?
Yeah.
You always wash your hands before. And after. That's a given.
And these are not the bestest, but that's okay. Now this hand is sterile. I can touch the whole glove here.
She's going to get all fingers under there to protect it, and then her thumb will come away.
Okay. Once I get started,
now if you do that, that's fine, but see where she's grabbing now? She's still staying in the area that's sterile. She can't go down to her wrist.
okay. First thing I'm gonna do, I'm just gonna separate. I'm gonna have 2 4x4s in the pack. I'm staying away from my 1-inch border.
Yep.
And the trach dressing, I'm putting out of the way so I don't confuse it. Okay? You can open up your pipe cleaners if you want.
But I can't touch that outer 1-inch border because it may have been an area that you touched and contaminated.
What I'm gonna do now, I'm gonna keep the inner cannula inside the big tray.
Nice and low because it has a fine mist that'll spray, and you don't want that in the other chambers or all over the table or you. Or
And I don't want to do like this because I'm going to contaminate the other side. Just to show them. I'm going to do the inside. I'm just touching the white collar, the thick plastic.
Yeah, don't ever touch the inside part, even though you have sterile gloves on. It's just good practice
Right.
to know that you never touch that part.
And once I do the inside, I do the outside. I do not go back in the inside. I don't want to bring debris back in there. Okay? Leave the brush in there.
Rinse, rinse, rinse,
Rinse, rinse, rinse, rinse. Get rid of all that peroxide. Grab one of my 4x4s. Then I'm going to take my one pipe cleaner. Just dry off any of the droplets of saline that are inside the inner cannula.
And she's dropping it on her glove package, not on her sterile field.
I'm not touching, I'm just dropping it. Same thing with the other pipe cleaner.
What makes the best noises while
This hand will remove the tray collar. This hand, I'm going to start with the inner cannula from 9 o'clock position
So it
to
goes in like
6.
this. Right, it goes in like this.
So
You
9,
slide down to 6 and advance.
and it just twists. Okay?
And you can kind of feel a little when it locks in place.
Now, basically, the inner cannula was a thing that we were really concerned with sterility. So these Q-tips, I didn't have all my Q-tips.
I will say that there's 5.
There's 5. In the last little container. So it's Papa Bear, Mama Bear, and Baby Bear. This is Baby Bear. Okay? You will have 5. I did not have 5. I'm going to pretend I have 5. Okay? So I'm going to go from the stoma, which is the hole where the trach is in, and I'm going to twirl it out. I'm going to move this away.
So she's going to go here, underneath,
Stoma
and
out.
pull it out. So she's pulling that mucus away. Then she'll go under here and pull that direction to pull all the mucus out. Then here, pull it all down. Here, pull it all up.
And
So you're removing it.
pretend this is my last one. I would do the faceplate.
Now that's wet, and wet skin can break down. So she needs to dry it.
So my other 4x4, 4 corners of where the stoma. So I'm drying it very gently.
And she uses a different corner for each in case she pulls out some secretions that were
Right.
left behind. You're not reintroducing them.
And then I'm going to fold it in the middle.
And that center is nice and clean for drying the outside.
There you go. How's that, Timmy? You're doing good.
Around his head.
He said, I'm so happy. You're going to show him that thing first.
Mhm. Yep. So Timmy's trach ties have the twill tape, but in a lot of the hospitals they have these, which are really nice because sometimes that twill tape, it's effective for holding the trach in place, but sometimes it can twist and it can cause sort of irritation to the back of the neck because it's there at all times. So these are nice because they're padded, and it's really nice too because it's easy to thread this hard Velcro through the eyelet hole. It's a little trickier with string. And once you thread it through, it just goes back here and Velcros to itself, and you just do that on both sides to hold it in place. Whether you use these according to your agency policy or those, make sure that you put the new one on before you remove the old one. Because if she were to untie that old one and take those ties off, and he had a forceful cough, the whole thing could fly out, and that stoma would close and we'd lose his airway. So never take off the old till the new are in place. Even if it means getting a little mucus transferred from the old to the new.
So where the eyelet is, I'm just going to bring this twill tape. What I'm going to do, one is going to be a little bit longer, like 5 or 6 inches, than the other.
And she's going to straighten it out and make sure there's no
This
twists. That one's really twisty.
This is really bad. Okay. And then
We don't want to tie a knot here and then tie a knot here,
Sorry,
because
Miss
if that
Dixon.
knot is so tight that we have to cut it, you don't want those little cotton fibers going down into the airway. It can cause infection, and it definitely causes irritation. She's walking really close to her client at all times in case he starts to roll. She can grab him. So she puts the table out of her way and walked closest to the patient at all times.
I'm sorry, I don't mean to hit my back.
No, you're okay.
So the longer one, I'm going to stick in the other eyelet.
And the one place that she's going to tie a knot is back here behind the carotid. We don't want pressure on the carotid, back by the ear. So she'll tie it once, tie it again, that's one knot. Tie it one more time, 2 knots. But before she ties that first knot, she makes sure that 2 fingers can fit under there so it's not cutting into his skin. So every time he turns, it's making cuts on his skin.
Then I can take off the old one.
This one should be much easier than the last
Oh
one.
my gosh. I don't know who did the last one. I will thank them for it.
Well, it had to be somebody who was left-handed.
It wasn't us.
Mm.
That's okay. Poor little Timmy has such a small neck. Here it comes. I'm very gentle, because I don't want to be somebody yanking on me.
And so she'll lift his head and slide it through rather than yanking it.
Oh, I'm feeling
You kick the bucket?
Kick the bucket. There you go, Timmy.
And it's a good thing she's got her PPE on because he just coughed and sputum flew right on her outfit.
In my hair, yuck.
Well, not in your hair, I hope.
Oh, I've had it in my hair.
Well, I know, but I don't want to terrify them.
Oh, don't. Ignore that. Now, the tray, the tray dressing, very gently. And I didn't put this on before, because sometimes when you put the twill tape on with this in the way, you'll
Tricky.
fumble too much.
Yeah.
So very carefully, I'll put the one side up.
And she's putting it up under the string and sliding it under the faceplate because the faceplates a lot of times are really stiff.
Yeah.
Ours are a little bit flexible, but in the hospital a lot of times they're really stiff. Like you can't manipulate them at all. And if you pull on them, it's like, oh, you're yanking it out.
Does it hurt them at all?
It's uncomfortable. In the beginning, when it's a brand new, fresh stoma, that's painful. And if it starts to get really excoriated or raw, that becomes very painful. So that's why I said, anytime that gets wet, you should be changing that. That split gauze. Likewise, anytime that whole trach collar is full of sputum, go get a paper towel and wipe it out. Like that's really nasty stuff. Anytime their gown is covered in sputum, get a new gown. Okay, it's never acceptable for a nurse to come in and see that the patient is unkempt, dried blood, mucus, food stuff, any of that. You need to get them a new gown and make them feel fresh and clean. Just like, you know, if you drop something or like when my granddaughter spits up on me, I want to go change my shirt, right, and get a new one.
Taking off the gloves the correct way again.
And you saw she took the drape off already before the gloves came off
Oh, yes.
because it would be really disgusting.
Then what would I do?
Take off your
Glasses, man.
How does she know that he's okay?
Oh, she would listen to his breath.
And
Call it a full respiratory
Oh,
assessment.
she's doing full respiratory assessment.
Yeah, and that includes
No, sorry.
vital signs, a full set of vital signs. What else?
and
Skin color.
Yeah.
What else? Skin color, you're looking here.
And
Oh.
work on breathing.
Mm-hmm.
good. I'm giving you all the answers.
It is, yeah. And what else? Well, that's part of the vital signs. And then we did the auscultation. She was kind of choked up about it.
Sorry.
The auscultating, anterior, posterior, 6 to 8 places.
Right.
Not over clothes, not over bone. Never below the bra line. Because that's about where the lung fields stop.
And you'd be listening to bowels
Or liver, or kidneys.
or stomach or anything.
Mm-hmm. What questions do you have? You feel overwhelmed?
Yes.
Practice. First time you
It's-
practice, you're gonna say, that wasn't that bad. Second time, hey, piece of cake. Third time, you got it.
Or it might be, you do it the first time, you totally break sterile field over and over and over and over. The next time you do it, I hate the sterile field. The next time you do it, I'm never gonna get this. A bunch more times, by the time you sign off, you're gonna be fine. Sterile field for some people can be tricky. You know, don't let yourself get psyched out about it. But you have to just be cognizant of the fact that picture the sterile item as being like, whoa, I can't contaminate it. Right. If you put in your head that that's a special thing that you have to protect, you'll do much better picking up on working with sterile much easier. Any other questions about the trach care and the suctioning? Rakia?
Can you please repeat which goes in what section of
Sure.
the three sections in the trach?
Not a problem. In fact, I'll show it to you.
Okay.
The big one will be the half and half peroxide if your institution dictates to you to have peroxide.
Okay.
That Papa Bear. Mama Bear is gonna be the rinse, just the saline. Baby Bear is gonna be the rinse, but that's only gonna be for your Q-tips to clean off the stoma.
Okay.
Got it?
Yeah.
Oh, and when you come, we're gonna help you with it.
Okay.
Okay?
It will feel very, very awkward in the beginning because it's like chewing gum and rubbing your tummy and patting your head all at the same time. Getting that, putting it down and on off, on off, on off, on off while you twist and pull out, not letting it coil on itself, not letting it get contaminated, wrapping up with that hand in order to move the trach collar back, all those things. You just have to do it over and over and over and over and over and over, but you need to do it in the lab because we're the ones with eagle eyes. The minute you break sterile field, we're gonna be like, oh my goodness. That's why when she did that, I had that visceral reaction when she was shaking it in the others. I was like, oh, because we get that visceral reaction. We're like, ah. So coming in and practicing is the key.
Can I retire this one?
Yes.
Thank you. Because that was a struggle.
Yeah, it was a little troublesome. What else?
I can say this.
What do I teach them next week?
Physical. I think
Physical
Physical assessment.
Yeah.
Yep,
Physical assessments next week?
yep.
Okay, so, do you remember what I said week 1? The minute you learn a new skill, come in and practice?
Yeah.
So when are you gonna start practicing this?
Tomorrow.
Absolutely. Do you know why? You need to get this firmly started to be seated in your brain by next week this time. Because physical assessment is it's a whole nother beast unto itself. Okay? So don't look ahead to physical assessment yet. It will just undo you. Focus on this, but you have to come in starting tomorrow. I mean, you've got to start coming. I don't know if you have to work tomorrow, but what I'm saying, the message I'm trying to get across is get in and practice. And again, this is going to be one of those weird winters with weird snow stuff. You can stop.